Good morning, everybody. Thank you to the 42,000 people who were tested to 8 p.m. last night. And whilst that's been a sustained figure, and Dr. Chant always likes to see that testing number 40,000 or more, given the circumstances, we would like to see more people come forward and getting tested, especially those that are highlighted in Dr. Chant's reports, and especially around those venues, those suburbs within certain venues which have been highlighted by New South Wales Health. Last night to 8 p.m. we had 50 cases of community transmission, and most concerningly, 26 of those were infectious in the community. Now that's the number we need to get down to as close as zero as possible. And when you know that there's 26 cases that were infectious in the community, the only conclusion we can draw is that things are going to get worse before they get better. As Dr. Chant will highlight, one person who's been infectious in the community is likely to infect those closest to them. So just work it out. You go home, you give it to your parents, your siblings, you keep going to work, you give it to a work colleague, and then they take it home and give it to their parents and their siblings. And I think it's pretty clear that unless we reduce that level of people in the community that are infectious, we won't be able to turn things around as quickly as we can or as quickly as we should. And I do want to state that out of those 50 cases, the vast majority of those cases, and I can't stress this enough, are close family or friends of people who have COVID. So people are getting the virus and then spreading it to those closest to them. If you truly love your parents, your sisters, your best friends, please stick to the rules. And regrettably, Deputy Commissioner Warboys will be highlighting at least two very concerning examples where people have chosen to flout the rules, have had parties, because every time you consider breaking the rules, doing something wrong, you are affecting not just you, your closest family, your closest friends, but all of us who are subjected to the lockdown. I know that when all of us come together, we can make a difference. And we need to make that difference by also holding our friends and others accountable. I can't stress enough that for this lockdown to be as effective as we would like it to be, in a time frame that we would like to be effective, all of us have to work together to do the right thing. Cutting corners, flouting the rules is going to prolong the lockdown, and that's the last thing any of us want to see. I do want to thank the community, the vast majority of our citizens, for the response from yesterday. We've noticed a significant decline in mobility. We've noticed people doing the right thing, but that has to be sustained in order to turn things around. And I'm very concerned that to 8 p.m. last night, we still had 26 cases of people who are infectious in the community. And one message I really want to get across to people who have been diagnosed with COVID, please tell us the truth the first time round. When people withhold information, it means that their contacts are infectious, potentially infectious in the community. Eventually, our health contact tracers get to the truth. Please tell the truth from the first minute rather than after repeated conversations, because otherwise you put your closest family and friends at the greatest risk, and that's something we don't want to see. I'll now ask Dr. Chant to give a health update, Deputy Commissioner Warboys to highlight the importance of the police response, and I want to thank the New South Wales Police for the work they've been doing in the community. And I then, of course, will take questions. Thank you.
New South Wales recorded 50 locally acquired cases of COVID in the 24 hours to 8 p.m. last night. 37 locally acquired cases are linked to a known case or cluster, and of these, 23 are close contacts and 14 are household contacts of previously confirmed cases. And the source of 13 cases is under investigation. 2 new cases were acquired overseas. The testing rates have stayed up, but I challenge us to get out in higher numbers and be tested. In terms of the ICU and hospitalisations, we've got 47 people hospitalised. COVID is a severe disease associated with hospitalisation and, tragically in some circumstances, death. It is critical that we follow the stay-at-home rules. I'm making an impassioned plea for the community this weekend to follow diligently the advice we've provided. And I think you'll understand the reasons for my growing level of concern that we need to bring these case numbers down. There are 19 people admitted to hospital at the moment with COVID are under the age of 55. And of those, 8 are under the age of 35. Of the 16 people in ICU, 1 is in their teens, 1 is in their 20s, 1 is in their 30s, 1 is in their 40s, 3 are in their 50s, 6 are in their 60s, 2 are in their 70s, 1 is in their 80s. Of the infectious cases in the community, 26 were of the 26 that were infectious in the community, 13 were in southwestern Sydney Local Health District, 11 in southeastern Local Health District, 1 in Western and 1 in Sydney. But can I just say, across Greater Metropolitan Sydney, whether you're in Central Coast or down in our southern end in Wollongong, Shell Harbour, right across to Blue Mountains, everyone needs to consider that every time they leave the house, they have to minimise their exposures to anyone and follow the health advice. As you're aware, only 1 person is permitted each day to go shopping, and it should be for essential shopping. And you should have a clear understanding of what you need, and if at all possible, purchase it online. In terms of the key messages for today, I just want to also highlight the consequences of actions. So 10 further cases have been reported linked to the gathering at the Meriton Suites Waterloo on Saturday the 26th of June. So these cases are contacts of the people who attended the gathering and bring the total number of cases linked to this venue to 35. I think what we're seeing is chains of transmission, and we're having difficulty getting ahead of those chains. We need everyone to stay hunkered down this weekend, stay within your household, and if anyone in your household has the most minimal of symptoms, get tested. Echoing the Premier's words, it's critical that you tell the truth the first time. We know that everyone is human and makes poor decisions at certain times, but please don't compound that initial mistake by not telling us the truth the first time. At the moment, as we're trying to get ahead of the spread of the virus, we haven't got time to waste unpicking stories, going back and cross-checking and verifying. It is really essential, tell us the first time. What we're concerned is, our sole focus is preventing the spread of COVID. And my final message is that your loved ones and those you care about most are those that are going to be impacted if we don't follow the health requirements and the advice. And I think no one wants to do that. I also want to make sure that people are not concerned about having a COVID diagnosis. The best thing you individually can do is to know that you have COVID so that we can care for you if your condition requires hospitalisation or admission to intensive care. But also, if we can get ahead of the curve of the spread, we can protect your loved ones. So please think about the ones that are the most dear and near to you. That is who will be touched by COVID if you have it. Thank you.
Good morning. Thank you, Dr. Chant. Premier, 167 personal infringement notices issued in the last 24 hours, 67 of those in south-west Sydney. Overwhelmingly, the response by police when I speak to them is that the vast majority of people in south-west Sydney are being compliant, that they are staying at home when they're out, they are wearing a mask. The efforts by people in southwest Sydney in this first 24 hours have been commendable, and the police that are working those areas certainly want to extend to those people their thanks, but there is still many days to go yet. Commissioner Fuller has made it very clear that we will move resources where they are needed most and where the health advice says that the greatest effort should be. We'll continue in southwest Sydney, but we'll also move resources into places around Janelli and Miranda, some of those areas where the health advice tells us that we need to be to make sure people comply and stay at home. A couple of examples that I'd like to highlight is in Randwick, where police were called to a noise complaint, found 8 men essentially having a party or a gathering at Randwick, clearly against the public health orders. 8 infringement notices were issued and that party was shut down and those people left that house. Another incident up on the Central Coast at the entrance, where police again were called to a residence there where they found 5 people gathering in that residence. They were issued with infringement notices and told to leave. These are just 2 really good examples of what people should not be doing. The Premier has made it very clear in terms of the critical space that we are in at the moment. When people invite others to their house, it is a conscious decision to go against the public health order and put the health of themselves, those people in their home and their community, their family, at risk. These are just 2 events that really do highlight what we're saying, and that is that people need to take responsibility. They need to make good decisions. Every single time that you make a poor decision, you put yourself at risk, your family at risk, and also the community. Can I also say that over the next few days, that police will continue their efforts right across this state, to the farthest places where people think that they can escape Sydney and go on a holiday and again disguise that as some sort of business trip or some sort of activity. Police are investigators. Police will ask questions, they will find out the truth, and if you need to be issued an infringement notice, they will, and on times, if you continue the offence, you'll be arrested and put before the court. We really want people to take responsibility for their own actions. We want people to realise that the decisions they make will affect what happens over the next days. Thank you.
Premier, we've had 50 cases today. It's almost impossible that we would get down to 0 by next Friday for that lockdown to actually finish. What's a realistic time frame for Sydney-siders? Because some people are saying August.
Can I please ask people not to pay too much attention to commentary or what people who aren't experts might have to say. What we need to rely on is the health advice, and the length of this lockdown is up to each and every one of us. It's up to whether all of us choose to do the right thing and stick by the rules, or whether too many of us think that it's okay to flout the rules. Now, that is what will determine how long we're in lockdown for. What we will do, what Dr. Chant and I will do on behalf of the New South Wales Government, is make sure we keep the community advised of all the information we have, and if we come to any conclusions or any decisions, of course we'll communicate that as soon as we can. But in the meantime, what will determine how quickly we get out of the lockdown is what each individual does. And it does come down to a handful of people. Unfortunately, in a pandemic, we rely on everybody doing the right thing at all times. We know the settings we have in place are the right settings at this point in time. But what we don't know is how many people will choose to flout them. And that's why it's up to each individual. Please know, and I can't reiterate this enough, if you do the wrong thing, the people you will hurt the most are those closest to you. Those closest to you. Your immediate household, friends you have been in touch with, a work colleague you may have been in touch with. The people that are closest to you, that you love the most, are the ones that are going to get the virus if you do the wrong thing.
But Premier, wouldn't it be better to apply these lockdowns for a longer duration, allowing particular business and so forth to do planning, and maintaining flexibility to end them if we get closer to zero? Wouldn't a longer duration lockdown work?
Well, what we need to do is take the health advice. And Dr. Chant was very clear in that advice, and her advice was absolutely correct, that to be effective, you couldn't have a 3 or 5 day lockdown as has occurred elsewhere. We needed at least this length of time. And as soon as we have certain information to the community, we will provide that. But the greatest indicator for people to know, the greatest fact or figure we should be looking at, is how many people every day are infectious in the community on top of those who've been infectious the previous day. And to the 24 hours last night, we had 26 people who had the virus that were still out and about. And that is the concern. We need to get that 26 number as close to zero as possible. Now, that is the greatest indicator of what the situation is moving forward. And that is why we're saying to people, unfortunately, the vast majority of people who have been infectious have chosen not to do the right thing in the last few days, or when that was uncovered. And that's why Dr. Chant's message of please tell us the truth at the beginning. You won't get in trouble. We just need you to tell us so that we can make sure all of your close contacts, all the people we need to get to, we get to. Because when people withhold the truth or don't tell us what's happening, it just makes things last longer, and that's the last thing we want.
Premier, people are sitting at home looking for some hope in all of this. What is your best case scenario? You must have been doing some modelling behind the scenes. What is best case scenario for you?
Our best case scenario is for people to do the right thing, to acknowledge how serious the situation is for us. And I'm always an optimistic person. We can turn things around, and we probably won't see the difference, though, for another few days of the harder lockdown that we've put into place. I do expect numbers to be bouncing around. I do expect the situation to worsen before it gets better, because when you have so many people who've been infectious in the community, you have to assume, based on the pure maths, that that number's going to increase the number of cases. So I do expect case numbers to go up. But what I want to see is the number of people infectious in the community go down. And that is what is key. We cannot have people with symptoms acting as though it's okay to leave the house or okay not to get tested until they get sick. As Dr. Chant has said, we have a number of young people in ICU at the moment. And that is a phenomenon we've not seen before in terms of the broader population. So we all have to work together. And the length of this lockdown is up to each and every one of us. And I wouldn't give you a date or tell you a date unless we have more evidence and know that we've turned things around. But as soon as we do know, as soon as we do have any information, of course we'll convey it. I think the most important thing for all of us is certainty so that we can plan ahead and know what we're doing. But we don't have that data yet, and the full effect of this lockdown won't be apparent for another few days. But in the meantime, we just have to stop the number of people who are infectious, still pretending that there's nothing wrong, and still pretending that having symptoms and walking around the community is okay. It's not.
Premier, the new restrictions you brought into effect yesterday, do you regret not doing them 2 weeks ago at the start of this lockdown?
Look, every time you make an important decision, people have a view either end. What I know is that we have some of the best health experts, and not just health experts, but best advisors and contributions from the private sector, from business, contributing to the New South Wales government's ability to make decisions. And I have full confidence in the experts we rely on, and they have stood New South Wales in good stead. But what I want to really press home to everybody is we have to get out of this sense of complacency. Just because we've done okay for 18 months doesn't mean we can act in the same way. I know that people are tired. I know that people have been hearing about COVID and the pandemic for so long. But this is a very testing time for us. We need everybody to take it seriously. And we do rely on the best health advice and also the broader advice to make our decisions.
Of those 42,000 tests.
Is there an offer from the Prime Minister for the use of the military if required?
Oh, look, there's always offers, but we don't. We will make sure that we have the best resources deployed where and when we need them to make sure that we ensure compliance.
So that's on the table, is it?
Well, I just want to say the New South Wales Police Force is doing an outstanding job. I'm in regular, more than daily contact with Deputy Commissioner Warboys, in regular contact with Commissioner Fuller, and the police stand ready to increase resources and to move where the virus is. And that's why it's important for us to respect the position that police have when they come to our communities. It is to keep all of us safe. And we have to respect when police increase their presence, it's for a reason. When there's more boots on the ground for New South Wales Police, it's for a reason. And I want to commend police for the outstanding work they've done.
42,000 tests. Of those, how many?
I'm sorry, I didn't hear.
Of the 42,000 tests, how many were in those LGAs of concern in southwestern Sydney?
Yeah, I'll ask Dr. Chant to provide that information.
So on our regular epidemiology report that we release every week, we'll have that breakdown. We've certainly seen testing levels bounce in southwestern Sydney, but then decline. So what we are really calling on is for everyone to continue to come out and get testing. It's actually one of our assets that we have with our partnership with the private, quite a lot of testing capacity. And so it is important that we utilise that as another tool. I'd also just like to give you some information, just again to push another point at this moment. Please go and get vaccinated. If you have access, according to the eligibility checker for your vaccine, make that appointment now. And if you've had your first dose of AstraZeneca, go and get your second dose. It was asked of us the cases admitted to hospital, with 16 people in intensive care, 5 of whom require ventilation. So of those 47 people admitted to hospital, 37% are unvaccinated. 37, 79% are unvaccinated. 5 have received both doses of the Pfizer, but they're the Summit Care residents who have been admitted for observation and monitoring. 4 have received the first dose of AZ vaccine and 1 have received their first dose of Pfizer. So in summary, no one who has received 2 doses is in hospital. And that's a key message with this Delta variant. We do need to have 2 doses of the vaccine, and 2 doses of either the AstraZeneca or the Pfizer vaccine is incredibly effective at preventing hospitalisation and death, which is an incredibly positive contribution. So one of the things that people can do is continue to make those appointments. Obviously, we don't want you to go to the appointments if you've got any symptoms of COVID. Instead, isolate and get a test. But please continue to get vaccinated. Also like to just announce one other thing. We're also requiring people that are going into the regions for essential work to be tested before they leave. Now, obviously, there's a bit of a leeway, but we do urge people that are planning to go to the regions for that essential work to be tested, and so we're just flagging that as well.
The teenager that's in ICU, is there anything more you can share about that case, given how concerning that is?
That case is not receiving... is not ventilated, but obviously we don't release information about individual cases. But I think it's a salient lesson that COVID can impact across all age groups, and I'm not aware of any other specifics around that case.
Dr. Chant, in regards to the number of people that are under 35 that are in hospital, how many of them have comorbidities?
I will have to get that information, but I think the reality is we are seeing people without significant underlying comorbidities admitted to hospital.
In regards to getting the message out to southwestern Sydney, can you please talk through the actual methodology of translating health messages? Is it a computer-generated translation, or are you using human beings?
It's a very human process. So can I just acknowledge, and I don't really want this to be only about southwestern Sydney, and it's really critical that whilst we disclose where the cases are occurring, we're not complacent, because if you're in Western Sydney, if you're in Northern Sydney, if you're in any part of Greater Metropolitan Sydney, your risk is elevated. People have to move around for critical work, freight, logistics, but at this time we're asking everyone to really reflect about any, minimise those even critical movements if they can.
Because there are reports coming through that the information is delayed when it's being translated, they're waiting 24 to 48 hours, that some translations are sort of very literal and they don't quite make sense in a human fashion. So I'm just curious if you can actually, other than engaging with community leaders, as you've said over the last couple of days, when you're actually putting out written information, what is the method that you're doing?
So the advice that we've received very much from the community groups is community radio, getting videos from community leaders, and actually that very much, and sharing on social media is a very effective communication tool. We're doing a lot more pushing with the community radio and also having people from those communities speak to their community directly. We do a number of translations and also pictorials. So I think one of the things is communication has to be a two-way factor. So for instance, just to highlight an example, we've really been pushing the concept of what a household is. And a household is the people you live with usually. And I think because of the close connections across multiple family linkages, people are assuming when we're saying don't mix, they're meaning don't mix outside my family group. And so there's a clear distinction that we need to really be clear about messaging. A household is who you live with. So just because Nan lives 2 doors down or a cousin lives walking distance from you or in the next suburb, that is not your household for the purposes of what we're trying to achieve here. People should be only interacting with their household groups, and if any one of that household has symptoms, they should all get tested, because we're finding that transmission in households is so high, by the time we're getting one person, everyone's infected. And so that's been a clear message we've tried to get out and work with community leaders about how to get that concept. Also, we've had feedback that there's been quite a lot of confusion about the requirements of a close contact as opposed to the stay at home. And so the stay at home means, of course, you can go out for food, essential food, but in terms of if you're a close contact, it means you actually have to stay put and cannot leave your premise for anything other than emergency. So to some extent, communication is always two-way, and we've been testing with the community some of their understandings. But we have got Multicultural New South Wales, which I want to do a big call out to, who's been assisting in working with communities across the Greater Sydney metropolitan area and understanding their particular concerns and tailoring the messages, be they video messages or pictorials, or to convey some of the concepts which are quite complex.
Mr. Warboys, 2 questions for you, if you don't mind. The first one is, can I just clarify here, the people exercising, do they need to carry ID to prove, that they're not 10 k's away from home?
New South Wales Police would not be expecting everyone to carry identification, but obviously most people that I see exercising have a telephone and have often carry other things on them that clearly identify where they're from. But I'll go back to my other point, where police are investigators. So if someone provides details, regardless of whether they have a phone, a driver's licence or some other card, and police are uncertain or unsure, they'll make further inquiries, and of course they can issue that personal infringement notice at any time.
Can I also ask you, do you have officers patrolling supermarkets looking out for that to ensure that there's just one person shopping?
Police are well aware of the public health orders, and they're briefed every day coming onto duty that what the public health orders entail. Clearly it is now about a single person leaving a household for that purpose, and police will attend locations where they think people don't want to comply. Absolutely they will, and they've been in supermarkets, they've been in shopping centres right across New South Wales, and they'll continue to do that.
So the point is that if someone wants to go out and shop, the warning is, look, there may well be an officer there keeping an eye on the fact that you're by yourself.
Absolutely.
167 personal infringement notices, 67 from southwestern Sydney.
Yep.
Where were the other 100 from?
Right across Sydney, but certainly, for instance, there was I think around a dozen issued in the northern part of the state. So every single one of our regions, we have 3 in Sydney and 3 in country New South Wales. Police are actively visible and where they need to, responding to complaints of behaviour or noise complaints. or any of those things where we understand that people are very keen to make sure people comply. So the message is, and we've seen it right along, that your neighbours, people in your street, people that are out and about will contact police with information about people that are outside the public health orders. And when that occurs, police will investigate it and they'll take action.
Deputy Commissioner, with all these COVID patrols, is that taking resources away from other things that police would normally be doing, i.e. dealing with domestic violence complaints and that kind of thing?
Yeah, look, absolutely. The front line, that first response of police is intact and strong right across the state. The COVID response meshes in well with that. It's a large police force that's well resourced, and we have no trouble and no issue going about our daily duties and doing our COVID work.
Premier,
Premier, sorry, one question. Can I just ask, the people in ICU, are any of those vaccinated?
So I think I gave that information, but yeah.
37 of the total.
There's nobody with 2 doses.
Yeah.
Premier, Dr. Chant, can I just ask quickly, of the 26 or 27 that were out in the community while infectious, were they symptomatic? Could they kind of have a bit of an idea that they may have COVID?
Look, it's important to remember that people. Sorry. It's important to remember that people are infectious for 48 hours. So every time we give these numbers, it's the fact that the person is not necessarily doing the wrong thing. They just don't know yet that they're infectious. Some people, we find a smattering of people that still go about their business with symptoms, and that's because they probably think I'm at low risk, I probably haven't got it, they second-guess symptoms, and we're saying, no, don't do that. So many people are out there whilst they're not aware that they've got symptoms, and so therefore you can't pick someone who's actually got COVID. What's really important is this weekend, if we can just go about our business and ensure that we don't have contact with anyone. So even if you have to go to the shops, choose the checkout, the checkouts, the self-service checkout, keep your distance from others. This virus is more transmissible, but it still needs a degree of proximity to transmit and a duration. So don't go and chat with the checkout person. Do not go and have a conversation with anyone. Make sure your mask is well-fitting. This is a time to get what you need and get out of any indoor environment and stay in your household. And I know we're getting lots of questions about loopholes. And, can I do this and what if I'm doing that? The principle is we do not want you to have any interactions with anyone outside your household. That is the principle we're trying to achieve. Yes, we have to construct public health orders or give public health advice about that, but that is the clearest message I can say for this weekend. Please stay at home, only leave if you absolutely need to. Defer things. This shop online, only shop for essentials. Yes, you can walk around the block. No carpooling to get to your exercise. We really do not want to bring you into contact with anyone from outside your household.
Premier, I have a workplace question.
I'm sorry? People having parties, people lying to contact tracers. Are you frustrated that more than a year into this pandemic, people still aren't getting the message?
I think it is frustrating when people do the wrong thing because it affects all of us. So can I please urge people, we're not asking for much, I don't believe, given the situation we're all in. If everybody does the right thing, we'll get out of this as soon as we can. But if people continue to flout the rules, that is our biggest risk of a prolonged lockdown, and none of us want to see that. Can I please urge people to look inside themselves, to really dig deep into their own consciences and do the right thing? If not for yourself, think about your closest loved ones. Forget about the rest of us. But if you truly care about the loved ones, those closest to you, you will refrain from doing anything which is outside the rules.
Premier, can I just bring a workplace question to you? And to best illustrate this, the downer workers at the Opera House, who are contractors, now they were close contacts to a case at the Opera House who had been forced to take 14 days annual leave. So they're taking their 14 days from annual leave, as opposed to the other workers at the Opera House who are taking sick leave. Now, my question to you is this: is it fair that companies ask people to take these 14 days from their annual leave.
Well, that's the private sector organisation, and
but they're contracted to the government.
right,
They're a government contractor.
Yeah, we can't. Can I just say the government can't control every single private or non-government organisation or business. But what we can do is appeal to people, and can I say, overwhelmingly, employers and employees have done the right thing by each other, and I just encourage that to continue.
Premier, there's a lot of pressure.
Sorry, just Lizzie.
One
Yeah.
of the health on Australia is no browsing. There are stores open today that sell jewellery, furniture, all over Sydney. And those people are okay because they're just trying to make, pay the rent. Does there need to be an order to clarify what is essential, or should those stores voluntarily close?
I think what is important to note is that we don't want anyone leaving their home unless you absolutely have to. That's the bottom line. But what we also appreciate is in some circumstances people need to attain essential groceries or essential goods, and we get that. But we know, both anecdotally in our mobility statistics and certainly what police are reporting, that most retail outlets at the moment are completely empty. But it only takes a few people to do the wrong thing, and unfortunately, the most recent examples of COVID that we're seeing are people gathering together when they shouldn't be. And they're the most recent examples we've seen of the cases that are emerging, and that's why I'm appealing to everybody. Please do the right thing. Please don't think that you're an exception. Please assume every time you leave the house that you have COVID or you're in contact with someone with the virus. The basic message is stay home.
But Premier, those stores are allowed to open under the health orders, but you told people not to go browsing. So what should those stores do? Should they just close?
Well, look, it's pretty obvious. If you need to buy a essential white good, or you might need to buy a baby product, it is a fine line, but we're appealing to people not to leave home unless you absolutely have to. As Dr. Chan and myself have been saying for days, if you can, go online, click and collect, have as little contact with anybody else as you can, especially obviously outside your home. We're saying to people, stay home, only leave home if you absolutely have to. And if you do have to leave home, please plan your trip. Whether it's buying groceries or buying an essential item, please plan ahead, work out logistically what is going to ensure that you have minimal contact with anybody else. And in the main, people are obeying and respecting that.
Premier, the government's asking a lot of community groups to get the message out there to multicultural communities. These people are often volunteers, they might be members of certain congregations. Is the government considering any kind of grants or funding for groups like that are doing that?
We've already provided that. We've provided millions of extra dollars to community organisations to support them in getting out information. The New South Wales government's actually already done that. And we actually announced that also as part of our business response. The Treasurer did as part of his package. So that's very much there already. But please
is any of that being directed to southwestern Sydney considering
absolutely. It's been directed to where it needs to go, and the overwhelming response has been positive in terms of a multi-channel response. We're using all channels, traditional methods, modern methods to make sure we get the message out. But we know that word of mouth is also critical, and that's where community leaders come into it. I was really pleased to have to be involved in a virtual meeting with over 250 community leaders in key areas. And the response has been positive. We're relying on our leaders to help us get the message out, but also for loved ones to get the message out to their own loved ones. Telephones, virtual Zoom, people are using all forms of technology, old and new, to get the message out, and we're really relying on that. In the main, our experience is that the vast majority of people want to do the right thing. It's important for us to get the correct information to them so that they understand what their obligations are. And I just appeal to the small number of people who are choosing not to do the right thing. Please reconsider, because your actions will have effect on those you love the most.
Premier, just one final question about people who live alone. Is there anything you can suggest for those that might be struggling? And I know in Melbourne they introduced the social bubbles, which probably is not a place for it right now.
In relation to people who live alone, which is the question about, that's why we've allowed obviously the outdoor exercise with 2 people. So if you live alone, you can have contact obviously by safely, in a socially distanced way, having exercise with someone that you know. And obviously through various services we do have support for people who are isolated. For those who cannot obtain essential goods and services. We do have the exception for people for carers to go and support them. So there are multiple ways to support people who do live on their own, and we know it's a difficult time for everybody. Whether you're home learning, whether you're supervising home learning and trying to juggle your own job, whether you live alone, this isn't easy for anybody. We get that. It's hard for all of us. Thank you, everybody.
Thanks, guys.